Hello, and welcome to Wellness Wednesday with 3W. Wellness Wednesday is sponsored by 3W Medical for Women, a nonprofit medical clinic offering free of charge or low-cost reproductive health services to women in the Seattle area, regardless of income or insurance status. 3W does not profit off of the reproductive health choices women make. The information shared in this podcast is the opinion of the speaker or speakers. Medical information is not intended as individual medical consultation, but for general education only. Always consult your own health professional for personalized advice regarding medical decisions. And if you're in the Seattle area, consider making an appointment to consult with us. I'm Helen Nguyen, CEO and co-founder of 3W Medical for Women and the host of today's podcast. Hi there, Wellness Wednesday listeners. I am in the studio with two lovely guests today. One is zooming in from the beautiful state of Texas. You know how much I talk about Texas and how much I love Texas, how much I would really move there. But I'm not going to just yet. This is not me saying I'm leaving. I will one day if the price is right, though. But so, yes, I have a guest down in Texas. She's in Houston. Beautiful lady. And then we have in the studio specifically is Aleksandra, who's right now she occupies our lead MA position, right, Aleksandra?
Yeah, that's right.
Yes. Is this your first time in the podcast studio with me?
I did one podcast when I first started working just to kind of introduce myself.
Oh, yeah.
But
yeah.
This is my first topic one. So that's exciting. Yeah.
Okay. Well, today we're going to talk about a very exciting topic called FEMM. And you heard me talk about FEMM so many times, people. But FEMM stands for Fertility Education and Medical Management. It's one of those programs that 3W is so proud to be able to provide to the community in a plethora of ways. This episode is to introduce you to two more certified FEMM teachers that we have brought on this year, as well as just there's things brewing, people. There's things brewing in the next first quarter of 2026. And these ladies are pivotal players in getting us up and ready and running for FEMM to really explode in such good ways. There is so much talk right now on social media and in our world in general about what reproductive health looks like, should look like, and how there are appropriate ways of talking about reproductive health in ways that elevate women, and then reproductive health in ways that really manipulate and coerce women into thinking that their body should be suppressed or working against them. And I just thought it would be really helpful to have these two ladies in our studio today to really talk about why they got involved in FEMM, why they find it, intriguing and good healthcare, and what they've gained out of it themselves. And I think if you haven't heard about FEMM, if you want to know more about FEMM, please make an appointment with either one of these ladies. Okay. So initially, FEMM started with us pretty quickly as we first opened, but we had Lauren Searden go through the FEMM training, and she was our first certified FEMM teacher, and she got super, super busy, which told me that FEMM is hot. We need to get more certified teacher. And so I reached out to Andie, and then we had Aleksandra join, and then now they're certified FEMM instructors and teachers. So okay, let's start with you, Andie. Where are you from, and what's your background, and why were you intrigued with FEMM?
Thanks for having me, Helen. So I am from Angleton, Texas, which is just south of Houston, which is very busy. But as far as my background, I've been a nurse in the operating room for, I want to say next year will be 10 years now.
Wow.
So it kind of ties a little bit into my interest with FEMM. Other than my personal life, I definitely, working in the OR as a circulator, as a nurse, one thing I've loved is being the voice for the vulnerable, or being an advocate for the patient. So, right, one of the most vulnerable times is when you're asleep, knocked out in surgery and can't speak for yourself. So I do like that, having my patient one-on-one interaction, and I really find joy in helping the community and just healthcare in that way, on top of the anatomy being very cool. FEMM, personally, I found natural family planning, like the general aspect of it, right? Like the umbrella, because there are many different NFP programs to follow. I didn't find that actually until my late 20s after I've already had my first two children.
Mm.
And so I was following it. I was like your typical young 20-something-year-old girl after I had my first two kids, where they told me after I was having like pelvic pain or abdomen pain, they were like, "Oh, you're showing signs of early endometriosis. To help with the pain, let's just put you on the NuvaRing." I was just like, okay, like there's a doctor. I haven't even finished nursing school at this point. I'm like, okay, like they know what's best. With the NuvaRing, I was on it for so many years, and then I discovered NFP through church. There was some girl one day that was like, "Oh, we're going to hold classes, introductory classes for those that are interested." And my husband nudged me in that direction because I hated the side effects of NuvaRing. I knew it, something about it did not feel natural or did not feel right personally. Interestingly enough, we do that, and just like with anything you learn, there's always a self error. So we did end up pregnant with our son. But along with that, just the journey of me figuring out like what my body's trying to tell me, symptoms that it was just really masking and putting a band aid over when I had the NuvaRing the whole time. It was really eye-opening. So then also changing like OBGYNs and people who follow those methods, right, to understand, again, what is my body telling me? So at that time, I was doing a Creighton method. Of course, it's just looking at your mucus subjectively. So as a nurse, I knew what that meant, but I was also struggling with it. And then after my son, we found the Marquette method, I think through like Instagram or online. But Marquette method is so much objectively, like solely through their method. After that, I learned new ways through that method. It wasn't until after we had our twins that I came across the FEMM method. And then when I found FEMM, I just fell in love with it because like the nurse science side of me with all the research background into it, on top of what I had learned objectively, subjectively, like it was like a perfect blend of the two on top of so much more.
Yeah.
So I just fell in love with what FEMM does, what it means, everything I think I was looking for originally when I was coming off the NuvaRing. I just got really passionate about it very quickly, and luckily ran into you, and we got the ball rolling, getting me certified.
Yeah. From a nurse standpoint, would you say that FEMM has been such a beautiful mix of what you were looking for? And you talked a lot about like listening to your body and honoring what your body was telling you, but that's not what the medical community usually leans on or leans towards.
Right. Absolutely. So I think that was what like sparked the interest, is the nurse side of me, just seeing the science, the background, the research institute information to support all of this, because just with different people I work with, not all of them are faith or religious based. And so when I tell them about natural family planning, they just look at me like I have 7 heads, So, but when I come at them with the scientific, right, research behind it, then it's like going down to like 2 or 1 heads.
Right.
So I really did love that it was supportive in that aspect, when I can have that conversation with people.
Well, you mentioned natural family planning a lot in this conversation so far, but I feel like FEMM is more than just natural family planning, right? It encompasses this tool to learn about your body before you're in a relationship. And who doesn't want to know that, right? Who doesn't want to foster that type of relationship before they become someone's significant other, right? It's just about empowering yourself first. So I see it more of like a reclaiming of reproductive health for women who are trying to honor what their bodies are trying to do on a natural standpoint versus artificially maneuver it, if that makes sense.
Right.
Yeah.
I would agree.
Yeah.
I would totally agree.
Thank you. That's so beautiful. Okay, Aleksandra, your turn. I told Aleksandra before we started that I cannot introduce her last name because it's beautiful and I'm going to mess it up. So Aleksandra, can you tell us more about yourself, how long you've been a part of us, and why you like FEMM?
Yeah. My name is Aleksandra Holovinska.
There you go.
There we go.
So pretty. It's Polish.
Yeah. I'm from Kirkland, Washington, but I grew up in a Polish family, so that's always been a big part of me. In terms of 3W, I joined as a sophomore in college. I started as a volunteer, and then that was in maybe October or November, and then the following summer, I became a medical assistant. So I've worked for 2 years now, I think. I graduated earlier this year from the University of Washington. After that, I increased my hours here. I became the lead MA. And in that time, or shortly before that, I became FEMM certified. And yeah, I really love teaching the FEMM classes. I think what you just said about how it's more than just the natural family planning side, which is obviously so important and so beautiful. Yes, but seeing how it's for really anyone, that's kind of what I tell anyone when I say that I teach FEMM classes, because I relate to what Andie said, where you say natural family planning or anything like that, and people are like, oh, because there's that connotation of
Yes.
whether it's religious, that it doesn't work, that it's just
It's
like
the
myths.
rhythm method.
Yeah.
Yeah.
And I'm like, no, that's not the classes I'm teaching. I'm
Exactly.
teaching women about signs you're already seeing, but I'm just telling you what it means. Like, I'm not telling you, it's so neutral. It's just, I'm telling you anatomy. I'm telling you, what your hormones are, how they're changing. And that's going to happen regardless of your stage in life, regardless if you're wanting to have children, if you're not planning on that. So that's what I really appreciate about FEMM, like that research side of it, and that it really is for anyone. And it's so digestible, in my opinion. I feel like some people, if they don't come from a scientific background, they kind of have this almost like fear, like, oh, I'd rather just like do this other method or like use birth control because I don't understand this. But the way FEMM is structured is to make it digestible for everyone so that you can understand your own body and advocate for yourself.
Yeah, I always say things like, explain it to me like I'm a 5th grader. And I feel like FEMM totally helps because let's be honest, guys. You guys are both medical professionals. You guys have your own lingo. I mean, there are acronyms and there are big words that Helen can't pronounce. And sometimes you kind of go to a medical professional and they're spouting all this at you and you're just like, okay, I have no idea what you just said. And FEMM does a really great job of translating, of not dumbing things down, not dumbing things down, not diluting the truth in any way, but helping us capture exactly what we need to know based on our bodies and kind of like helping us digest it in a way that is like unique to us, right? And so I think there are people that really appreciate it because they're very like that kind of brain of like, tell me big words, make things complicated, and I can track. And then there are people like me that are like, girl, I need you to tell me like I'm 5 what I need to do. What am I looking at here? What are these textures? I remember like taking pictures of my mucus and being like, what am I looking at here? And so that makes it very accessible to everyone from every walk of life. You do not have to be religious to do this. In fact, I think there's a lot of women that are interested in this. They just don't know about it.
Right? I agree.
Yeah. And there's a lot of people that are sick and tired of their birth control. And they're like, I do not want these side effects. First of all, I don't want something random floating inside me, which is like wild to me that some of these devices can live in your body for 3 to 5 years. Wild. And then secondly, women are looking to complement their bodies. Oh gosh. They're looking to complement their bodies. They're looking to like work with their bodies. And there has not been a lot of resources out there that are kind of neutral, right? I think FEMM comes from this neutral standpoint of like, let's just lean in on the science of our bodies, work with our bodies, and here's the science to back it up. It doesn't have a religious connection at all, actually, but anyone can use it regardless of how what are your goals, what are the things you want to achieve with it, either pregnancy or not, either just holistic health or not, just finding out why isn't my body working the way it's supposed to. What are some patterns that you've seen, Aleksandra, in the patients that you've served of like, what do they say to you after your first class? Because your first class is kind of like that basic anatomy class, right?
Yeah. The first one, I always tell people, like within the first few slides, we cover anatomy, the hormones, and then the uterus and the cervix changing. And people will kind of look at me like, oh my gosh, all of that in 10 minutes. Like, and there's 3 classes of this. And I'm like, no, but that's the thing. This is it. Like, this is all the like new terminology I'm going to give you. Now we're just going to apply it to your life. We're going to learn how to like work with it and how to understand it. And so I feel like once we do that in that first class, I feel like people are pretty excited to kind of get started on tracking their cycles, because again, like it's like cervical mucus, like that's something that women are already seeing. They just don't know what it
that
means.
it's telling a story.
Exactly. Like
Yeah.
that it has some purpose. And so I feel like a lot of women leave that first class excited to just kind of be like, okay, wait, I've seen these things. And now I can take this and actually understand it a little bit better. And what I really like about the second class is we schedule it after one cycle, so we can now like actually not just look at these like perfect charts that FEMM has on their slides, but it's like, let's look at your cycle, let's apply this to your patterns. And so I think that excites women to be like, okay, great, this is really tailored to me, like I'm actually gonna get stuff out of this. So I feel like that's definitely been a common pattern. I think of patients as, or yeah, the people who do it in like two ways. There's the people who come to do it for maybe like religious reasons, for church, for marriage, anything like that. And then there's the people who are non-religious, but they just want to learn it. And I think in both of those cases, they're excited to try it regardless of what their initial reason to join was. They're excited to see something new and see how their life changes from that. Yeah.
Wonderful. Andie, as a parent, why do you think this benefits children as young at, like especially girls that start their periods who are so confused about what their bodies are doing, and how we cannot continue to rely on the school system to teach our children about this kind of stuff, because it's not really elevating their bodies and creating a conversation about like body positivity or like your body has dignity, your body has worth, and this is how it works. I mean, I don't know about you, but in Seattle, that's not the conversation these kids are having in sex education. It's more like, how do you put a condom on a banana, right? That's sex education up here. So as a parent, so talking from a parent's perspective, what have you thought about FEMM for your girls?
I mean, again, when I found and discovered FEMM and like what it entails, like y'all have mentioned before, like it's more like your reproductive health, which ties into your overall health. Like, oh, now I know in this cycle or leading up to these days why I'm acting this way or why I'm feeling this way, right? Like it like tells, like you were saying, the mucus and so much more tells a story. And so I think back on just even myself as a kid when I had started my cycle. I'm like, man, this would have been wonderful to know.
Yeah.
As a teenager, when you're already confused and figuring out, the awkward phase of life.
Yeah.
So as a parent, I'm even more excited. I've already told my daughter, because I have an 18-year-old daughter and a 15-year-old daughter as well. And I've already told them, I'm like, before Lily leaves off to college, I'm like, we are going to get these sessions. Y'all are going to figure this out. Y'all are going to be informed about it, informed about yourselves. That way, when you're off at college, like, you have, again, some idea of what's going on with my body, like, and how to react to it, how to be proactive about it, or however. Because you're right, as far as the school system, especially here, it's just what I remember from school, where they give you that video of your cycle starting, pads, tampons, things like that. And then, like you said, sex ed of like just using a condom. Oh, don't worry, you have to use a condom. And even surprisingly, even in the professional world of the medical field, at least where I am at, that's still like the agenda mindset is like, oh, well, kids are just going to be reckless anyway. Like, just teach them that, right? Like, teach them how to use a condom. That's all that really matters to prevent STDs and things. And it's like, no, you're right. It like minimizes it rather than elevating.
Yeah.
And giving them empowerment with the information of, oh, you can learn what your body is telling you.
Yeah. And we have a teen FEMM track that we reach out to young girls as the minute they start menstruating. We really want them to receive this type of education with their parents' blessing, of course, like, and letting parents know, like, this is a really safe, value-based, like, aligns with your values type of curriculum or training and teaching. And from what Lauren has told me when she's done, Lauren did this really cool class, 3 FEMM classes, but she had like a group of cousins and their moms that came with them. And she was saying how all the cousins were like tracking their periods together, and how that was really, really encouraging for this group of girls to do it. And then it opened a lot of conversations up with their moms, which is so good, because their moms are then able to meet them where they're at during their cycle and not getting frustrated of like, why are you so moody? And why are you like this? It's like, no, we know why we're in this position together, and we can really help each other get through this. And then it has fostered a lot of beautiful conversations about just like boys and relationships and hormones and all of that stuff. And I think as a parent, that's exactly what we want. We don't have the time to like read a whole biography, like a whole bio book, and be like, this is how your body works, right? But FEMM has been able to dissect it down to what are the core things young people need to know about their bodies. And then it allows the parent to then enter into that conversation and further solidifies, yes, your body is beautiful. It's made like this. There's nothing wrong with you. And if there are questions, ask me, because I'm the parent and I want to be navigating these really tough conversations with you, alongside you, and I'm not the enemy, right? I'm not trying to like suppress you from doing anything, but just honoring that season in a teen's life of how confusing hormones can be.
Yeah. And funny enough, you mentioned the parent side of, like you said, I feel like maybe media, like movies, make it the appearance of like, oh, she must be on her cycle, right? Or, oh, that's why she's PMSing or however, right? Funny enough, like my husband, since we've gone on our own personal NFP journey with different methods, he's learned about it so much that he knows, like also with our daughters, like, oh, like I know it's because this and this and this.
Yeah.
Like,
That's a smart man.
Like, you're able to give more grace and like, to recognize like this is what's going on. It's not necessarily that person's fault or they're purposely or intentionally maliciously acting this way.
Yeah.
So yeah, it's even helpful for dads.
Oh,
honestly.
yeah. I think doesn't that foster a more beautiful relationship between fathers and daughters? Like, like, and it sets the bar high for their, boyfriends and in the future of like, my dad knows that around this time there's chocolate and fuzzy slippers and a lot of like, what do you want? What do you need? I will get it for you. I always think that sets the bar really high for like future boyfriends to be like, okay, guys, get with this.
Yeah, I love that.
I
That's
know.
so funny. I really always think that guys should also learn this too. Like,
yes,
whenever we table, we have that spinny wheel with the questions, and I always see when there's like a group of college boys, they see the candy prize, they're like, okay, let me go, I'll know this, and then they spin it and it's some question like how many eggs are women born with, and they're like, or like what are the phases of the ovulation cycle, and they're like, oh, well, can I spin again? I don't need to know that. And I literally always tell them, I'm like, do you have a girlfriend? Do you want to have a girlfriend? Do you want to have a wife? Like, then yes, you do need to know this. Like, yeah.
My favorite, I think I said this to the staff, my favorite meme out there right now was, I'm so sorry I was possessed, but it was just my period, so I'm over it now. Like, it's like someone takes over. Oh my god.
Yeah, you're a whole other person.
Yeah. And you just want to eat like popcorn and chips and just lay there and watch Pride and Prejudice and be left alone. And that's like a real thing. Just leave us alone. But then hug us, but then go away. Like, we don't want that all the time. Gross. But like, there's an explanation for all of this. I love that question, Aleksandra, when we have this like spin the wheel reproductive health questions and the how many eggs is a woman born with. We've had people say 7, 2, 20. And I'm like, there are people that have multiple kids. How did they come about if you only have 2 eggs?
Yeah.
I'm always like, guys, this is sad. Like, come on, go take biology class again.
Yeah, I think my favorite question, or like the one with the weirdest answers, okay, well, I think is either how long can sperm live in the reproductive tract or how long can the egg live? I think both of those are questions. So in both of those, I get a question or answers like 6 months. And I'm like, no.
She's fertile all the time.
Yeah, he's just setting up camp. He's just like, I'm not leaving. You guys can do whatever you want, but I'm not doing. I mean, they stay in your body for a very long time. Most people think 24 hours, 48 hours. But what is it, Aleksandra? Like 7 to 5 days?
Yeah,
no, 5 to 7 days?
5 to 6, yeah. 5
to 6 days.
Yeah.
See? I mean, they do set up camp, but then they move on.
But not for a few months.
Right.
Yeah,
not like
got a different unit there.
Yeah, like a week.
Yeah,
and then they got to move on to something prettier, maybe. I don't know, like something more inhabitable. But yeah, isn't that wild?
Yeah.
You can get pregnant up to 5 days.
Yeah.
Wild. Crazy. Our bodies are magical creatures. Or like, how many eggs is a woman born with? 2 million, right? 2 million eggs, guys. That's wild. How did Oh, go ahead, Andie.
I was going to say, sorry. And just me being pregnant right now, that there's a certain point, like I think it was saying that whatever gender my baby is, because we're not finding out till the baby's born, but has already, it's predestined, it already has all its eggs. If it's a girl, it has all her eggs in her ovaries right now.
Yeah, it's like a Russian doll. It's like one of those dolls that have like dolls inside of it, especially if it's a girl.
You have 2 million little dolls inside
you. You have 2 million little dolls inside of you. And I'm always just thinking, how do the suckers fit all up in there? Like,
right?
How does that even happen? Crazy sauce. But yeah, whenever we do like that talk I gave about just like asking the crowd, like, all these reproductive health questions, and a majority of them had no idea. How many eggs? How long does sperm live? What's another thing that people always ask? Like, can you get pregnant on your period?
That's one. Yeah. I know there's some questions just about general health too, because I mean, women's health is not just reproductive health. It's general health too, and people won't know what a pap smear is, how often they should be getting that, when they should be getting that.
Yeah. How STIs are usually like asymptomatic. Like you don't have symptoms. Yeah. You don't know.
Oh, there's a question, how much blood is shed? That one always gets some fun answers because
people
never know where to go that way.
Yeah.
I feel like it was like 1.5 shot glasses. I know that's in parentheses on that sheet. It's like 3 tablespoons, I think. Right. Yeah. 3 tablespoons, I think.
Yeah. It's not that much.
Yeah. It feels like a lot more in my opinion.
Yeah.
Right.
But there's like a lot of water, I heard. That's it mixed with it. Yeah.
Yeah.
But what other creature on this earth? My husband always, this is his running joke. He thinks he's pretty funny, but he's not. But his running joke is, what animal out there bleeds for 4 days and never dies? Women. That's what. Okay? We're amazing. We're freaking amazing. We can bleed for that long and can work and can mother and can do so many things. Men would probably just die.
Right.
That's probably what they do. They'd be like, I'm bleeding. I have to get ready to just pass away.
Right.
But that's the amazing part of being women is we can do all these things on top of just living life. I always wonder how Olympians do it when they have to, like, what if they have their period on the day that they have to like run really fast or something?
Yeah. A lot of people were saying that with like the Eras tour. They were like, that was like touring for over a year. So there had to be some days where she was like weekend after weekend after weekend. Like there had to be some days and she's performing for 3 hours.
Yeah, that's not my life.
Yeah.
No.
Yeah.
Oh my gosh.
Like you said, amazing creatures we are.
I know. I don't know how we do it. Just FEMM is wonderful. And we're just so excited and thankful for the both of you and your expertise and your passion for this topic that if anything, it benefits each one of you. And you then become this mouthpiece in your community, in your world for other women to be like, no, there's something going on. You should probably get that checked out. This is why. This is what your cycle's telling you. It's your 5th vital sign. Lean into it. And then there are men in your life that's going to really appreciate you giving them a heads up. Like, I just want to let you know there are things in my life that's happening this week and I need you to be really, really patient with me. And I think that really builds communication and relationships and healthy relationships for anyone. So I'm just so excited and thankful for each one of you for saying yes to being our certified FEMM teachers. And if you are curious about what FEMM can do for your life and how it can change your life for the better, please make an appointment with either Andie or Aleksandra at 3wmedical.org. We are ready to rock and roll. We got 3 FEMM instructors now. So that's Lauren, Aleksandra, Andie, that are ready to tell you what your mucus is trying to tell you. They're going to be like, this is what it's trying to tell you. And we affirm that. And it's not weird. Stop trying to get rid of it. Your body's constantly trying to tell you something about your health. We're going to be leaning into more FEMM resources. We're bringing on 2 clinicians that are going to be leaning in on the medical management side of things. That means we can start diagnosing things, people, which is like mind-blowing because there is not enough good reproductive health clinicians out there that aren't going to shove some sort of agenda down your throat. I can tell you that from a personal standpoint of going through last week a very terrible doctor's visit. I won't tell you what clinic it is because I'm not that kind of person. But I was very much talked down to by another clinician that was trying to shove, again, reproductive health advice down my throat that I told her explicitly I did not want to have as an option. So we are like I said, stepping into next year with FEMM, more invigorated, more excited for what we can do. And we want to be that FEMM clinic for you in Washington State and through telehealth with Andie in Houston. So any last words, ladies, about FEMM? Aleksandra, any last words?
I'm just going to kind of reiterate what we were saying, how it's really for everybody. And yeah, regardless of people's reproductive goals, like this influences your general health too. The hormones we talk about, like estrogen, progesterone, they are influencing your bones, your brain, your blood sugar, everything like that. So being able to track ovulation and your menstrual cycle overall, it's not just telling you about whether your hormones are sufficient for reproductive purposes, but also for your overall health. So this is just so important to know. Every woman should be knowing this and learning this and comfortable with this so they can advocate for themselves if any issues were to arise.
I agree. And I was just going to reiterate also as well that don't feel intimidated by FEMM. Like, like you said, you hear all the fancy lingo, you didn't go to medical school, you're not in the medical field. So that alone can be intimidating. Going to the doctors alone, like I know lots of people who don't go to the doctor because it's intimidating.
Yes.
So, but like you said earlier, FEMM, y'all both explained it well. FEMM does a really great job of having it digestible, understanding, not watering it down to the sense of minimizing it, but like just enough for you to gain that foundational understanding and knowledge that is so needed, especially in this day and age.
Stop taking your medical advice from TikTok, ladies. Just come to a FEMM class. Then you will be empowered to know more. TikTok can only tell you so much. So, all right. Well, you know what to do. Sign up for a FEMM class. It's very accessible, affordable, and with these lovely ladies that I can have a conversation with all day long because they mainly just let me talk about random stuff. But other than that, thanks for listening to this podcast. And thank you, Andie.
Thank you for having me again. This was great.
Yeah. Thank you, Aleksandra.
You're welcome. Happy to be here.
For more information about 3W, please visit our website at 3wmedical.org. That's the number 3, the letter W, medical.org. From there, you can learn more information about the services we provide, book an appointment, or make a donation if you'd like to support our mission. You can also call our office at 206-588-0311. That's 206-588-0311. If you like this episode, please share it with others and consider subscribing on your favorite podcast platform so you never miss an episode. Thank you so much for listening, and until next time, stay healthy and be well.